Doping. So doping is when you um, perform, take drugs or other types of procedures that will enhance your ability to perform better within sports competitions. There are several types of medications that you can take for doping to enhance your performance um, out of the rule. You It is regulated by the WADA, which is a World Association for Doping, and they have a list of published a list of drugs that are banned from using during competitions, meaning that you are not allowed to use these types of medications throughout the preparation of the competition, and you are at the opportunity of being tested randomly anytime. So some different types of doping methods are um, so stimulants can be taken. You can take narcotics or diuretics. You can take peptide hormones and so these are some broad categories of types of medications. So starting with stimulants meaning that it will stimulate the brain, the central nervous system, and it can be also stimulating other parts like the heart or the lungs or the muscles. So one example is cocaine. So cocaine is a type of um, local anesthetic. It can relieve the pain as well as have excitatory mechanisms. Um, Also, alcohol is banned, so you're not allowed to take alcohol, which may relieve certain anxiety and allow you to be more excited. Uh, so adrenergic receptor agonists, so things like alpha agonists or beta agonists are banned. Alpha agonists can so they have effects on vasodilation, increasing inotropy of the heart, bronchodilation. Um, I am not sure which one is which, but these are some effects. Uh, and and amphetamine is the last kind of that can cause doping. It will excite your brain central nervous system, and it's useful in competitions such as boxing and this kind of thing. So for narcotics, so narcotics is things that will take away the pain, such as fatigue during things like boxing or marathon running, where there may be increased sensation for fatigue, and by taking these narcotics, you may reduce the sensation of fatigue. And those things include things like um, opioids, opioids, uh, cannabis, and for example, of opioids, we may talk about heroin or morphine, and these are banned substances. For diuretics, so diuretics are often used in competition to reduce the weight. There are several different types of diuretics acting upon different parts and changing the levels of urine output. You may have loop diuretics like furosemide, which will act upon the loop of Henle. You may have potassium-sparing diuretics like spironolactone. And so these are some examples. Uh, it can be dangerous to use these sometimes because you might end up with dehydration and hypotension if they're used poorly. And we may also talk about peptide hormones. Peptide hormones, for example, erythropoietin is a type of peptide hormone that is produced from the kidneys, and it will stimulate the bone marrow and to produce more red blood cells. And when you have more red blood cells, this will increase your capacity, or like VO2, meaning the consumption or the transportation of oxygen will increase, and you will have more oxygen available in the blood. Some problem with this, on the other hand, may be things like strokes or some thrombosis because your blood is more viscous because of the increase in the red blood cell, and might cause these vascular problems. Others include things like insulin growth factors, insulin-like growth factor 1, and growth hormones. These are basically hormones that will increase the anabolism of the body. So things like powerlifting, boxing, anything that requires a lot of muscle strength will need this kind of medication, and it's banned. And lastly, anabolic steroids. So again, these are types of hormones that are derived from cholesterol. They're androgens like testosterone, dihydroepiandrosterone, um, which is the activated form of testosterone, and it will basically cause the body to build up muscles. Things like increase in glycemia, um, um, and proteosynthesis may happen. And again, it's useful for things like powerlifting, where a lot of muscles is useful for the competition. So obviously, there are some negative aspects, not just being banned, but it may lead to things like testicular atrophy or sterilization, acne formation, um, and 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 for women, it might lead to, again, like acne formation, menopause. I mean, amenorrhea, and these types of symptoms may be present for doping. These are some introduction to doping. So the role of prescription of strength and dynamic training in primary and secondary prevention of uh, chronic diseases include things like, so what is strength and dynamic strength training? So strength training is when you are performing muscular training. They uh, are usually training that um, train specific muscle groups. They are non-repetitive, or they may be repetitive, and are usually containing a lot of resistance, using weights or elastic bands or some things like this. And dynamic strength training is when you don't have resistance, or you have less resistance and have more repetitive movements um, under um, in order to build things like endurance. And so strength training usually leads to things like anaerobic metabolism, while dynamic training usually leads to um, aerobic metabolism of things like fat. And so in prevention of primary and secondary prevention. So primary prevention meaning to prevent disorders like metabolic syndrome, obesity, diabetes, atherosclerosis, strokes, myocardial infarction. All of these diseases can be prevented by prescribing certain medication exercises. Secondary prevention meaning that these diseases are being treated with the prescription of these dynamic training. So what do we prescribe for primary and secondary prevention? So for starting with secondary prevention of diseases like hypertension. So in hypertension, we have a high blood pressure. So we it's usually caused by like atherosclerosis and and so prescription would be things like exercising regularly 3 times um, per week for at least 30 minutes, and mild dynamic training is usually used. Things like walking or slight jogging uh, may be useful. You should aim for a VO2 of 60%, meaning that um, the maximum amount of oxygen that you are using is at 60%. So it's not like 90% or 30%, it's at 60%. Um, for obesity, where you have BMI above 30, it's dangerous to prescribe dynamic strength training because it will have problems with osteoarthritis or pain in the joints. So it's more important that you give certain medications to reduce weight loss or change the diet. Um, and for diabetes, for both type 1 and type 2. So for type 2, where you have more insulin resistance, it's very similar to hypertension. It's important that you give regular training at least 3 times per week. Better if it's done every day, but it really depends on the patient. And so for like 30 minutes per day of mild aerobic exercise at 60% VO2. Mm, and um, for type 1 diabetes, it's important that you do not take insulin before you do these exercise, and check your blood level of sugar to make sure that you do not have hypoglycemia, hyperglycemia, and take some certain snacks. Can be important because it's important, and also monitor your hydration levels during the exercise. Especially if you are dehydrated, it can lead to very severe outcomes. So it's important that you are regularly hydrating yourself with water and to drink regularly before you get thirsty. And some some contraindications to these would be things like if you have really low levels of glycemia, or if you have really high blood pressure, it can be dangerous. Uh, mm, yeah, so these are some examples of things that is important for this strength training and dynamic training prescription. Hi. What are what are exercise tests in laboratories? So these tests in laboratories are things like treadmill tests or bicycle ergometry tests, where you will increase the cardiac output and you will try to see symptoms such as blood pressure changes, heart rate changes uh, during the exercise. Also, levels of oxygen in the or carbon dioxide released from the breath or pulse oximetry are important to monitor during these tests. They're used often in diseases like coronary artery syndromes where or like chronic coronary artery syndromes where you are trying to find the extent of the disease by inducing increased cardiac output and stressing the heart so that the heart becomes so it reaches its limits. And uh, it's used as a diagnosis for these coronary artery diseases. So, um, so what are these functional variables about? So things like VO2, HRBP, RQ, and pulse oxygen are things that reflect the parameters of the patients. VO2 is the volume of oxygen utilized uh, per minute, so how many liters per minute the patient's using. Um, and this can be determined by uh, the amount of oxygen remaining in the expired air. I think after exhalation. So and it's used hmm, and for heart rate it uh, is detected with ECG, Holter ECG, uh, and this is important to monitor during the exam because, for example, if you are exercising but the heart rate does not go up or it even goes down, then this may indicate heart failure. And blood pressure is also important to measure. You will usually use a cuff on the arm and it will take a blood pressure throughout the tests. Again, it's important to monitor the blood pressure because normally with the increased exercise, your blood pressure will rise in order to try to oxygenate the rest of the body and perfuse the rest of the body. But any drop in this blood pressure may indicate some failing of the heart or other autonomic system. Uh, RQ is respiratory quotient, and respiratory quotient is the amount of carbon dioxide released divided by the amount of oxygen used. So, so usually with the increased exercise, the amount of carbon dioxide released will be increased, while the amount of oxygen being intake will decrease. I mean, increase as well. But the ratio might increase with increased exercise because the body will metabolize more while the amount of oxygen that's being used may be at a steady level. And this is also monitored. The respiratory quotient will be different for different types of exercise as well as different nutrients being used, like proteins will have a higher respiratory quotient, while fat will have a lower respiratory quotient of around 0.7, and protein will have around 1. And for pulse oxygen, this is about so pulse oxygen is about measuring the amount of oxygen saturation within the extremities. This can be on the fingertip or the earlobe, and it uses a certain light, and it tries to measures or it measures detects the level of oxyhemoglobin, or the hemoglobin that's binding to the oxygen. And by this, it can measure the level of oxygen within the extremities. And this is important because if you have things like claudication of your vessels, then or coarctation of the aorta, things like this, they can all stop the perfusion towards the extremities, causing a reduction in the SpO2s and may indicate these problems. Lastly, the effect of drug medication. Um, so there are drugs used on patients who cannot perform exercise testing. Things like um, uh, things like drugs that will increase the anotropy of the heart, or so things like dobutamine uh, or adenosine can all do this, while uh, some may increase the blood pressure of the heart, uh, and others may intentionally increase the um, sympathetic system. Things like adrenaline may be used, and again, this is to detect any types of abnormalities within these parameters on patients who cannot exercise by inducing a similar effect upon the body as when you are exercising. And and just so these are the examples of the effects of drugs, medication for exercise testing. So so for metabolic syndrome, what is metabolic syndrome? The definition of metabolic syndrome is a multitude, so it's a combination of four symptoms, clinical symptoms. It is diabetes, obesity, meaning BMI of above 30, hip to waist or hip to waist ratio is increased, or waist circumference is above 104 for males, or for females it's above 82 centimeters. It also depends on the race of the patient. And the last one is dyslipidemia, meaning increased levels of triglycerides, LDLs, total cholesterol within the blood. So, and this is metabolic syndrome in general, and so the morbidity of these patients are increased. The risk of stroke, myocardial infarction is increased, and other types of neuropathies, vasculopathies, retinopathies, nephropathies may all be present in these patients. It's quite common in the older age, and especially in males. And some treatment options, again, it includes medications as well as diet and exercise. Medications include things like insulin sensitizers like metformins or gliptins that act upon receptors and increase sensitivity to insulin, reducing the blood glycemic indexes. Uh, Also, statins or fibrates may be used in order to reduce the levels of cholesterol and triglycerides within the blood. Um, Also, diet again is important to reduce the weight. Uh, so taking less food in general, less calories, more more nutrition with important vitamins, proteins, less carbohydrates like sugar, especially sugar, and are important for the diet. And for exercise, again, it's quite difficult to force these patients to stick to a exercise regimen because of their weight. May have osteoarthritis due to the weight. So you should start with very mild exercises like swimming, where or cycling, or uh, like rowing a boat, where you will increase your heart rate and your VO2 while not putting too much pressure upon the joints. And yeah, uh, so so those are the basic metabolic treatments. For cholesterol levels, apart from fibrates and statins, you can also use um, um, okay, so there are some other medications that can lower your cholesterol levels, and mm, yes, so that was about the treatments. We go on. Metabolism or principal nutrients during physical exercise, nutrition, and sports. So some energy sources for exercise is so we can divide it into three main types. One is rapid energy source. Next is a quick energy source, and then the last is the more long-term energy sources. For the rapid one, we have things like ATP and uh, creatinine phosphate. These are high phosphate energy substrates that will give you energy, rapid energy for approximately 10-second maximum. It is stored within our muscles and will provide with quick bursts of energy. The next is glycogen. So glycogen, which is stored in the liver and in the muscles, um, are sources of energies for the first 1 to 2 minutes. It will also give you a relatively strong energy burst, and it is done by converting pyruvate to lactate via the anaerobic metabolism and producing ATPs. And the last type is fat. So fat is the more long-term solution. It is done by beta oxidation within the mitochondria, and it is an aerobic metabolism, so it requires oxygen, and it supplies for many tens to hours. And people who are not trained are usually not capable of using anaerobic metabolism due to things like because they're not trained to do it, and they have less amounts of mitochondria, and the vascular supply to these muscles and the lipids, adipocytes, may be reduced in comparison to people like marathon runners who may have more adipocytes, which are highly vascularized. And so there's three principal nutrients in our food. So it's carbs, lipids, and proteins. Carbohydrate, again, is important for these glycogen storages, while lipids and proteins. So proteins may be used in case there is no glycogen left, and protein or amino acids, more specifically, may be oxidized and converted into glucose and glycogen, while uh, adipocytes will, like I said, will be converted to triacylglycerol and free fatty acids, which will enter the mitochondria. And so, so it's so these are the main types, and uh, so it's very important that you take water with it and try to balance um, your hydration status throughout the exercise because you will sweat and you'll lose electrolytes. Also, um, you should take important vegetables because these will help with your anemia and it will increase your level of hemoglobin, which will obviously help with the exercising and sports. Also, proteins are important for building muscles, especially in exercises that require a lot of muscles. Um, in terms of calories, like the fat will burn around 8 to 9 calories per gram, while proteins will burn approximately 4 calories per gram, and sugar as well, around 4 calories per gram, and which means that fat has the highest level of calories, and 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 therefore it's important. The difference in strength and dynamic training. So in strength training, it will use more of these ATPs, glycogen, because it's short bursts of energy. Uh, while dynamic training, like running, walking, will use more of these aerobic metabolism, which are important, especially for your metabolic indexes. It's better for improving training, I mean, your health and primary prevention in comparison to um, strength training, which will only target these quick muscles. And yes, so that was about nutrition and sports.